Our hospitals here in Colorado are under a tremendous amount of pressure right now, which is why a doctor in southern Colorado wants to give you an inside look at what they're facing. Here's Anusha Roy.
We are dangerously close to the limit.
Dr. Sandeep Vijan is the chief medical officer at Parkview Medical Center in Pueblo, a hospital used to being very busy, but what they're seeing now is unprecedented.
Have you guys ever hit 100% capacity with your ICU beds?
Absolutely. We hit 100% almost every 3 to 4 days.
Today, more than half of the traditional hospital capacity was taken up by COVID patients.
Time being, when we hit that 100% capacity, we hold patients in the emergency room until a bed opens up. Those hold times can be up to 18 hours in the ER. So if you can draw a straight line down I-25 from Pueblo to the New Mexico border to Raton, that whole geographic area is us. We've started reaching out to retired folks. We've started reaching out to, there's something called the COVID force.
Through that national volunteer agency, 8 volunteer nurses, respiratory therapists, and EMTs will show up next week. But Vijan says that they can't keep operating like this and has a specific message for those who may still not be taking this seriously enough.
Cannot see the ventilators, they cannot see the ICU, they cannot see what they need to see to make it real for them. For those people who have not been affected by COVID, it's very easy not to see the crisis. So ask them to think about this. If the hospital is full of COVID patients, what happens to you when you're in a car accident, you have a heart attack, or you have a stroke? The top 3 things that a hospital deals with. If I have no beds for you, what happens to you?
So in some cases, they've had to actually ask nurses to increase their nurse-to-patient ratio. Then they're bringing in non-nursing staff to help out the nurses with their increased workload. They're also been asking some people to flex their responsibilities at work, step into positions that maybe they haven't worked in a while. And Jeremy, all of this is to address that ongoing staffing issue, which is a very real concern for hospitals across the state right now.
That was a pretty blunt reminder from that hospital there, Anusha. What about patient transfers?
Yeah, so Parkview, which is the hospital we profiled today, it has this relationship, right, with a couple of other hospitals where they'll take in patients. And today they said they feel terrible. They've been having to say no because they just don't have space for it. In fact, Jeremy, they've been having to transfer their own patients out to other hospitals that do have more room than they have currently.
What a time right now. Thank you, Anusha.